Hi, everyone, and welcome to the inaugural Fulbright Speaker Series. My name is Leland Lazarus, the Vice President and Board Vice Chair of the Fulbright Association. As a Fulbright alumnus to Panama over a decade ago, I've witnessed firsthand how the Fulbright program fosters international understanding and intellectual exchange that has truly given the power to shape our world one person at a time. And it's in this spirit of connection and transformative collaboration that we've launched this speaker series, where we bring together scholars, leaders, and experts from various disciplines to exchange ideas that lead to real solutions to the most critical global issues facing us. Now, this isn't just any other virtual speaker series. Our ultimate goal is to inspire real action for positive change. Today's conversation will focus on mental health, a subject that impacts each and every one of us, both here in the US and around the globe. Our expert group of panelists today will explore recent trends in mental health, how to recognize potential risks in our own lives and the lives of our loved ones, and share key resources and tools for community support. Joining us are Dr. Patrice Moulton, CEO of She Is Half the Sky, a psychologist and Fulbright Association board member. Also, U.S. Army retired Lieutenant General Mike Rochelle, who is a professional certified coach and CEO of MDR Strategies, and Dr. Victoria Kress, incoming president of the American Counseling Association and director of the Clinical Mental Health and Addiction Program, as well as professor at Youngstown University. It is now my pleasure to introduce Sarah Happel, Fulbright board member and the moderator for today's discussion. Sarah is a master certified coach and the CEO of Spectrum Leadership Solutions, the sponsor of today's discussion. We are so fortunate to have you guide us in today's conversation. Sarah, over to you.
Thanks, Leland. It's an honor to be here. Wow. I'm wearing several hats today, also a fellow Fulbright Association board member. I was also an alumna to the University of Helsinki back in the 90s, and I am CEO and founder of Spectrum Leadership Solutions. We are a boutique leadership development and executive coaching firm, and we believe firmly in supporting the resilience and well-being of individual leaders, their teams, and organizations. So it is just an honor to be able to partner for this inaugural, really important speaker series where we will be bringing very important topics to you, to our former Fulbrighters, current Fulbrighters, business leaders, students, and communities here in the US and around the world. So thank you, Leland, for the warm welcome. And I'm so excited to be a part of this very important conversation around mental health, something that we're seeing our clients and our leaders deal with each and every day at an exponential level. So without further ado, I'd like to jump in and start asking some important questions, some of which have come from you, our listeners today, with this important panel. So Victoria, I'd like to start with you. Dr. Victoria Kress, she is incoming president of the American Counseling Association. And with the swirl of mental health right now, I would love to hear your professional take on some trends that you're seeing here in the US and even internationally.
Thank you, Sarah. What a great question. There's a lot going on in the mental health arena right now. Some of it not so good, and some of it is kind of exciting. One of the things about the global pandemic that we recently experienced is it really put a spotlight on mental health. This was one of the first times that we heard people across America and even the globe start to talk about mental health and focus on what mental health is. Historically, we've often discussed more psychopathology or problems in living, but during the pandemic, there was a focus on problems and struggles around mental health, but also a focus on how we could be more preventative and amplify resiliency and robustness and help people be healthy. What we've been seeing in recent years is a decline in mental health. There are some definite red flags that point to things that we should be really concerned about. And people don't realize there's such an important link between physical health and mental health. And the leading cause of disability worldwide, that impacts over 1 in 8 people globally is mental health disorders. There's a lot of different reasons this may be. Part of it, people often talk about the pandemic and its impact, but one of the things that even more research shows as significant and important is the rise in our gadgets, the rise in the internet, the rise in using social media. Our smartphones have really disconnected us from people in so many ways. And we see this when we look at numbers of who is affected. We've had a whole generation of young people growing up with phones, getting phones often in elementary school, certainly most of them maybe by middle school. And we're seeing how this is impacting mental health. We're seeing a rise, particularly in girls and young people, a rise in anxiety and depression and body image issues that seem to be linked to social media use. It's something that we really need to be thinking about. How are we talking to young people? How are we talking to caregivers about young people's social media use, and how are we monitoring for that? When we look at the who's most affected by the rise in various mental health issues, I mentioned young people, but LGBTQ plus or sexually and gender diverse populations are also particularly impacted by the recent rise in mental health issues, as are minoritized populations. So racial and ethnic minorities, people who have different ability and disability statuses, they tend to experience many mental health disparities in terms of access to care and getting good care. And this could also be a risk factor that may contribute to greater mental health issues in some of these populations. There's a lot of other reasons that we're seeing a rise in mental health problems. I mentioned the social media piece, the digital age, which I think is really important, but there's also issues around systemic gaps in care. So people having access to mental health supports that they need. Again, we know that minoritized populations, people from more rural areas often also have difficulty getting access to quality care. There's a lot of different policy changes within the United States government right now as well that pose threats to people's access to care. So when the primary payers of mental health services are Medicare and Medicaid. And as we hear our legislators talk about cutting those programs, that's only going to contribute to a rise in mental health issues. There's also several overlapping crises that I think are really important to think about when we talk about mental health care. One of those is related to what we call deaths of despair, deaths of despair. And what this refers to is the opioid epidemic that we've been experiencing in America. We've also been seeing a rise in suicide and alcohol-related deaths as well. And all of these deaths of despair have trickle-down effects and have significant impacts on youth and families and communities. And we can't overlook the importance of the role that plays in escalating mental health problems. A final thing that I want to mention is the issue of climate change. Eco-anxiety and climate distress are also something that is really on people's minds, particularly Generation Z and our younger people have great concern about climate change and how it's impacting them now and how it is going to impact them in the future. And so that's another reason that we may be seeing some of these rises in mental health issues.
Oh, thanks for that. So many things to think about. The complexity of it. The numbers are staggering, 1 in 8. And thank you for taking us through the journey of what else that you're noticing and what the field and your colleagues are noticing. Can you talk a little bit about how you see the American Counseling Association also evolving to these vast needs?
Yes. I am the president-elect of the American Counseling Association. I mentioned our youth and how our youth are particularly vulnerable, I believe very strongly that there is a tremendous amount of childism, what I call childism, that goes on, not just in America, but across the globe. Children are often second-rate citizens, and they don't enjoy the same rights and privileges that adults do. And oftentimes we become adults and we forget about what it was like to be a child and how oppressive that can be at times. And so one of the things that I'm wanting to really focus on is this idea of childism and how the mental health profession, counselors in particular, can advocate for children and make sure that they have a voice at the table and that they're not treated just as children with no rights, but they're treated as people who are experts on what they need, and their voices are able to be amplified in ways that can help support all youth in all of the communities. So that's something I would really like to focus on. I also am really passionate about legislative advocacy. I find that people with big hearts and people who care and who want to help have a lot of passion and emotion around wanting to help, but they don't always know how to be effective at that beyond sharing their feelings with people around them, maybe sharing their feelings and thoughts on social media. And so I really want to empower counselors in our communities to become more effective at engaging in legislative advocacy, because legislative advocacy guides everything that we do. All mental health policies go back to legislation. So helping counselors to develop the various skills that they need to be effective at engaging in the legislative advocacy process is something that I really want to focus on and help us develop skills around. There's also a lot of different stakeholder mental health advocacy things that I think are really important. I mentioned the importance of legislative advocacy and making sure our policymakers are investing funds and supports and setting policies that support mental health, not just in youth, but across the lifespan. We have to really understand as a society that physical health and mental health are completely linked. These are not separate phenomena. And if we want to support people's physical health, we have to also support their mental health. As an example of that, we know that adverse childhood experiences, what in my profession we commonly refer to as ACEs, predict long-term health problems. So ACEs refer to childhood traumas, things like experiencing the loss of a parent, experiencing child abuse, the incarceration of a parent, feeling unsafe in your neighborhood, your community, in your family. The more adverse childhood experiences a young person has, the more likely they are to have cardiovascular disease, neurodegenerative diseases, heart disease, cancer. So we need to really stop treating physical and mental health as though they're separate, because they're completely linked. And we also need to be investing policy-wise in youth mental health, particularly looking at school-based services and early intervention and prevention. And I think this needs to be part of our United States strategy, but I also think globally, I would like to see all communities across our wonderful planet really invest more in youth mental health. There's also a really urgent need to expand culturally competent and trauma-informed mental health care. Historically, we have not functioned as trauma-informed mental health care providers, and we need to do better with that because, as I mentioned, adverse childhood experiences and all traumatic events, not just adverse childhood experiences, but also things like immigration, people who are refugees, people who have experienced war, people who have experienced natural disasters. All of these things really require sensitive mental health care intervention. So we need to do better about thinking about our mental health intervention from a trauma-informed perspective and with a focus on what's culturally competent and what's culturally appropriate. We also need, I think, in terms of working with our stakeholders, and we really need to be thinking about social media and what are the exposures and risks, and how is that impacting our young people. So that's something else that I think is super important. Um, and finally, I want to add that, we have a shortage of mental health care providers. And that's something that I'm a counselor. I'm working really hard to train more counselors to meet that need, particularly in our rural communities where many people are struggling, particularly in developing countries where there may not be a construct of mental health advocacy or mental health intervention. But I think we need to continue to focus on moving forward and thinking on how can we prioritize workforce development and prioritize getting people the care, the mental health cares and supports that they need.
Thank you for that. Such an expansive topic, such an expansive and complex issue, if you will. And thank you for breaking it down and walking us through where one might start. I think it's also interesting noticing how around the globe, how countries are reacting to similar issues. For example, we have Australia, who is now limiting or even forbidding social media for youth. We have Estonia, who is arguably the first country to actually teach teachers about AI and allow AI to be used in schools. So that's a legislative policy now that just got passed. So it's very interesting to see how everybody's reacting to all of the complexity as we move forward as well. Dr. Patrice Moulton, as a licensed psychologist and professor, you've seen a lot in the mental health industry over the last few years with your students, professionally, in education, over in Nepal, here in the US. One of the questions that came in from our listeners is, with this huge swirl of a mental health crisis and where we are right now, where do we even start to begin to address this?
So, as I start to answer this question, I just want to note the importance of any time we're trying to address kind of the mass things that are going on in our world and in our lives, the importance of putting our own oxygen mask on before we start trying to help other people. Um, and we see this in forms of self-care, just kind of taking a moment to make sure you're stable and that you're good to go and that you're steady for the people around you, and you will have so much more energy and so much more to give the people around you. And to find that if you're not in a place that you can do that, it's okay to step back and take a break, um, and give yourself a moment to become stabilized before moving forward to take on the responsibilities of others. It's a lot to take in, and thanks so much for having me today to share some information. I love sharing information on mental health. It's a passion of mine. We have a lot to address, but we also have a lot of resources. And one of the things that I think is most important to address when looking at the kind of these large issues that we have, that Dr. Kress talked about, is also putting some normalcy to it. So whether you're listening today as an individual who's kind of feeling a sense of anxiety or possibly depression over what's happening in the world, or just kind of looking for some support and a sense of not being alone in whatever it is that you're feeling, is to number one, say whatever you're feeling is okay. Number two, you don't have to be alone in it. And for me, I think it's also important to think, when we hear about all these things that are going in the world and the immediacy that we have with all the things that are happening in the world. So whether that immediacy is coming from technology or watching the news every day, from before the pandemic, we've had, information on pandemic, medias, natural disasters, um, violence that happens around the world. Within minutes of when it happens, we hear about it. Political debates and political policies and things that are affecting our lives, our families, our children, um, and even loss of jobs for many people currently. if we weren't all feeling some level of anxiety at this point, I would actually be more concerned if all of this were occurring and you were feeling perfectly calm. I would have questions about that. So the normalcy of this sense of anxiety and uncertainty. Uncertainty breeds anxiety, and the need to come together and have a sense of universality in that without automatically pathologizing that. That it's okay to feel off-centered. It's okay to be concerned. When we start to have concerns about that professionally is when functioning is affected. When you're not able to get up to go to work, when you're not able to take care of your children, when you're not able to do the daily life tasks that you need to be doing because of the levels of these emotions that you're feeling, that's when we need to reach out for professional resources to make sure that you get help you need and that those that you love get help they need. And if you are serving on a team professionally, that you are also looking out for the people around you that you care about, that you work with, and you are normalizing also getting help and saying, hey, you don't have to be in this by yourself. And here's a resource, and it's something that could really help you. And I hope you utilize it and stand with people around you in that. So it's normalizing feelings, normalizing the resources that are available, and normalizing getting help within that. So I think in order for that to happen, it means continuing to break stigma. And that means talking about it. Like, don't be afraid to share how you're feeling with people. And don't be afraid to share your hopes and your dreams and, you know, what I call the glimmers that you find during your days. It's those things that make you smile, a moment of happiness, something that brings you joy. Like, spread that stuff around everywhere that you can at this point. People need it. And don't be afraid to talk about it when you're down and you're having a hard day, to share it openly with the people around you and provide people the opportunity to be present for you. We are living in a world that kind of often expects us, sometimes requires us to be independent, strong, and that can create an isolation. So, really important to open up. I also just wanted to share quickly kind of a construct that we think of when we think of this trauma-informed counseling is that we think of mental things that create mental health breaks or critical incidents for people. If I simplify that down just as far as I can, we think about these additive effects of trauma. So like Dr. Kress was talking about, early childhood trauma can create later effects in life for people. Well, we know that continued trauma of any level has an additive effect. And if you think of that like a balloon being blown up, just a simple blowing up of a balloon, you know, every puff of air you put in it in and of itself is manageable until the last one that stretches the balloon too far. And then you have a critical incident of that balloon popping. And we find that many times all of our mental health and our ability to cope really functions on a similar level. So for people who start in a more vulnerable place, possibly a chemical kind of anxiety or depression, or multiple traumas. And then there's a pandemic, and then there's media, and then there's politics, and then possibly there's a job loss. At some point, any given one or grouping of those things is manageable. It's when it's the add-on that at some point creates this effect that causes a critical incident for that person. And so if we know that, then we also know that the way we take pressure out of a balloon does not require deflating the entire balloon in order for it to be effective. Sometimes it just requires taking that little part and just squeezing it the least little bit where you hear that air come out and we've released the pressure. So what that means socially for us in managing these things is being present for people around us in ways that just releases the pressure in the smallest bit. That can be checking in on somebody one day. That can be telling somebody you thought about them. When you think about someone, reach out. When you feel positively about someone, let them know. When you see someone needing something, a small act of kindness costs us nothing and can stop critical incidents by releasing pressure in a moment when it's most needed to the people around us. And so I think it's just a really important thing for us to kind of constantly monitor ourselves and release pressure in ways that we can control, whether that's through physical activity, supporting ourselves with people around us that we love that are supportive and make us feel positive, asking for help when we need it. There's all these little ways we release pressure for ourselves, but there's also a million little ways that we release pressure for people around us every day if we take the time to think about it. So I would put a challenge out actually for everyone who's listening to look around you, look within yourself, look within your families, look at your children, look at the people you work with and the people that you love, and find small pressure points that you can help release as you move throughout your days.
That's a powerful visualization of the balloon, and that we're not going for perfection here. We're going for lots of little things that add up to the multiplier effect. And how can we take care? I love how you emphasized presence and being really present to those around us. Can you talk just a little bit about any success stories that you've seen around this mental health swirl, either in neighborhoods or communities, or just something where you've seen, yeah, that's great. More of that. That's working.
Oh, I am so blessed to be able, surrounded with such positive people in so many ways that I see this on a daily basis. I see it with my graduate students. I see it in a mental health clinic that I supervise, professionals in training that are going to be the next wave of mental health therapists out there that we train all the time. So I see young people that are receiving therapy all the time, and I see graduate students that are training to be therapists that are going through their own struggles. And I'll use that one as an example of something so simple that it almost seems ridiculous, and yet obviously not. So one of our graduate students recently, who is studying clinical psychology, hoping to become a psychologist in the near future. She has this amazing bubbly personality, and she watches those around her carefully. And so there was a day when there was a tremendous amount of stress on the floor. Our clinic had been running with a lot of crisis that day. Our young people that come in for therapy here, we see quite a number of young people that are living on the edge, that have suicidal thoughts, that are struggling with their life and their world. And it had been a long day at clinic. And I had noted that the entire floor felt down. The energy was down, was low. I think the students were struggling with the amount of trauma that they were taking on as young therapists in training. And so I had thought about doing a debriefing session in my office, and I had called all the students in. This was like last week. I had called all the students in, and when they came down the hall, I had heard giggling, which was not matching the rest of the tenor of the day. And when they rounded the door and I said, "What are you guys like? What happened between that end of the hallway and this end of the hallway that you all seem to be in a different space?" And one of the students said, "It was the writing on the restroom mirrors." And I said, "Excuse me?" And they said, someone who was this bubbly student of ours had gone into both restrooms and had written like positive affirmations on the restroom mirrors that just said, "You've got this, chin up, you can do it, you're going to be a great therapist," on the mirrors and such. And they had walked in and seen that. And it was one of those just little tiny moments that released the pressure. They walked in, saw something, resonated, provided a moment of hope, put an entire class of 20 somethings that are studying to be psychologists in a different headspace in just a matter of seconds. And we obviously see some that are much more traumatic turnarounds for people where lives are saved, um, where people manage to get the help that they need. But the daily pieces are just so important, that are so small, that don't take a lot to do.
Beautiful example, Patrice. Thank you so much for sharing such a small yet powerful thing that we can all do. Positive affirmations. Mike, Rochelle, I'd like to bring you into the conversation here. As a retired Lieutenant General of the Army, you have held some very senior positions, senior leadership positions over your career. Now, as a business owner, you're on several boards of directors. I'd like to ask you a little bit about the leaders who are holding space for experiencing this mental health crisis that we're in right now. For leaders, whether they are leading universities or organizations, nonprofits, the federal sector, for profit, how can they best support their teams during these really stressful times and extreme uncertainty?
Well, first of all, let me thank you for the opportunity to be here today, Sarah, and the opportunity to share this venue with such intellect. Dr. Kress, Dr. Moulton. By the way, I love the balloon metaphor. It's really quite beautiful, and you called it out. How can leaders help weather the storm, if I may say it that way? Number one, I think, is to recognize the outsized influence that leaders have on teams, and whether it's a small team of 4, 5, 6, 10, or a team of hundreds or thousands. Leaders have, in many ways, a very, very overblown impact from their emotional state, more often than they realize, from their emotional state on the emotional state of the team itself. And with that, I would simply say, recognizing that we can always grow, continue to grow throughout all of our lives in that domain, that is emotional self-awareness and the ability to be competent in emotional self-regulation. The aspect of growth is something that I think is paramount for leaders. Again, recognizing that we are always learning and growing, ideally in positive ways. We can learn negative lessons, of course, but predominantly we want to take those lessons, that even the ones that are somewhat negative, if you will, and look for the silver lining within them. An example might be a leader, and Dr. Moulton did a beautiful job of describing it with the bubbly personality of a student who can have an extraordinarily positive impact on a team in very minor ways. A little bit of levity, a positive affirmation, maybe even a parable that most of us know from childhood or from adulthood, but simply in the circumstance may not be able to call that positive parable forward. And someone who is more aware of the environment, more aware of the situation in which the team is functioning. And that stems, I might add, from positive self-awareness, number one, because without that, one cannot be that simply aware of what's going on around him or her. The other thing I'd like to call out is Dr. Kress's mention of the depths of despair that can infect many teams, and especially in the area of the times in which we are living, which are very unpredictable and constantly changing. And that's the domain in which leaders must, I want to say, be comfortable, but it's yes and no. Recognizing that one cannot always be comfortable, one must then simply recognize, how am I, in my case, how is Mike Rochelle interpreting these circumstances? And then how do I wish to interpret these circumstances in which I find myself and my team? And how do I turn that into a positive outcome, performance outcome, organizational outcome? Growth, back to growth. I think it's again paramount. It's not something that we do always independently. We must rely on others. I must rely on others to help me see myself more clearly at times, and to be able to identify those areas of growth opportunities for me, and in so doing, help others recognize and identify their growth opportunities and their growth areas. I'll end with this, Sarah. Again, thank you for this opportunity. I'm really pleased to be a part of this. And I'll end simply with walking alongside another is, and recognizing that we are never, or ideally never, alone. That is also a very, very key lesson for leaders. My own personal experience would be learning that keeping counsel of the man in the mirror is not the best approach. Not the best approach. But reaching out and seeking external support, seeking external inputs and external realities is also very, very key. I'll end with that. And again, thank you for this opportunity. It's wonderful to be here.
Thank you so much. Also such a powerful answer. I'm wondering, looking at a question from someone writing in, and thank you for all the questions, keep them coming. What's the number one leadership mistake you see around this, and any suggestions?
Number one, that's a difficult, because I teasing the number one out of many is a challenge. And I would have to say that off the top of my head, I would say that it's not being as emotionally self-aware as a leader could be. And that's where I dare say that fellow coaches, and occasionally myself as well, help leaders to see themselves a little more clearly in various circumstances, and come to grips with the question, what else could be true here? What else could be true here? It's a simple question, but it simply opens the aperture to examine, I am thinking that this circumstance warrants X, or this circumstance warrants Y behavior, or Y intervention. But what else could be true?
Beautiful answer.
I hope that answers your question.
Yeah, terrific. As a final and maybe slightly unconventional question for each of you, and Mike, maybe we can start with you and then go back to Dr. Kress and Dr. Moulton. Drawing on your unique experiences, and each of you bring a vast array of the mental health field from very amazing backgrounds. Dr. Moulton, it's you trekking and your advocacy in Nepal, Retired Lieutenant General Mike Rochelle, it's your leadership and resilience building practices in the field, and as a certified coach with many years of experience in Dr. Kress's mental health work across East Africa. What's one personal resilience ritual or maybe a quirky self-care practice that you swear by, and how did it first become your go-to method?
Yeah, I think you said you wanted to start with me. And the first thing that came to mind is a talk I was giving several years ago at an embassy in Washington, D.C. Happened to be an embassy of an African nation. And at the time, I was speaking to the ambassador and his staff, and the phrase that many elementary school students learn, which is stop and stroll, or stop and roll. Excuse me, stop and roll. In the case of fire, stop and roll. And out of that, don't ask me how it evolved, but I simply came up with stop and reflect. Stop and reflect. Very simple. What's happening? How am I experiencing it? All of that is implicit in the phrase stop and reflect. And I could go on, but I won't. I don't want to take up time for these wonderful professionals and charming ladies to respond. Thank you, Sarah.
Thank you, Mike.
Mike, I'll go ahead and jump in. I was smiling when you were sharing because I didn't know what you were going to say, but what I was going to say was so similar. I'm a counselor. I specialize in trauma and child abuse, and so I've worked with children who have been sex trafficked and really severely abused for the last 30 years, and my work's hard. And so one of the things that I learned very early in my career that I had to do to be effective and help my kiddos was before my sessions, I would I would take a second and pause. And then I would be aware, I would be self-aware of how I was feeling. And then to kind of build on what Mike said, I would add an intention. So before I meet with my clients, I pause, I try to be aware, and then I set an intention of what I want to do and what I can do with this human and what I can't do with this human and who I don't want to be. So I set an intention. So for me, that looks like things like I want to be kind and supportive and patient. I want to leave my baggage out of my time as I interact with this person. I want to be supportive. I want to believe the best in them. So I just chuckling because it's just so similar to what Mike said. But that's something that was so helpful for me as a counselor that I've actually carried it into other arenas in my life. So whenever I'm entering a situation where I'm feeling a little nervous or anxious or unsure, or I just want to be my best, I stop and hit pause and think, how do I need to set an intention so I show up here my best? So kind of piggybacking on what you said, Mike.
So I'm not sure what this says about me, but mine's quite different than those two. Um, so I am a bit of a risk taker and always have been. And so I kind of have a life philosophy that is resilience for me because it is a calculated risk taker. Um, but I have a why not philosophy to life. And I work real hard at that opportunities, new people, new experiences, um, why not? And the way I get to trying it, but within a safe boundary, is kind of through this. It's kind of a cost benefit analysis that goes on in my head. But there's a term we use in our field called raising the horror floor. And it means stopping to think about what's the worst thing that could possibly happen. And then asking a few of those scenarios and asking yourself if you have the resources or the capability to either handle what's happening or to accept the consequence of it if things go wrong. And I balance that out with looking at what are the best things that could happen that are the possibilities. And if I feel like the possibilities are great and the worst things that could happen, I have resources either within myself or within a team that I'm with, to draw the resources to handle what's coming with something new in life, then why not experience it? Why not meet those new people? Why not go to that new place? Why not try that new experience, learn that new skill, put myself in uncomfortable positions? Because I feel like if I'm too comfortable, I'm probably getting stagnant, and that it's time to learn something new and be a little out of my league. I kind of like being a little out of my league. And so I think that builds resilience in being willing to be uncomfortable. Um, and that has worked for a long time with work and personal and travel and family, and has allowed an incredible amount of opportunities with wonderful people and experiences.
Thank you so much to all three of you. It has been a joy and an honor to moderate and be a sponsor for this first inaugural kickoff speaker series with Fulbright. And with that, I'll pass it over to Leland.
No, Sarah, thank you so much. And to Dr. Moulton, Lieutenant General Rochelle, and Dr. Kress, thank you so much for really filling our minds and filling our hearts with such an incredible opportunity to hear from you. My takeaways is leaders never stop growing. And we have to realize that we have an outsized influence in terms of our emotions and how it impacts an entire team. We have to remember the unique struggles that some of our children are dealing with. And as a father of a 2-year-old, that really strikes home. And then, of course, we need to find those gems of joy. And we have to realize that we will never, ever be alone in our struggles. So thank you so much. Your expertise and insights into mental health have truly been invaluable. And of course, a special thank you to Sarah Happel, our moderator, for guiding today's conversation. We really appreciate your leadership in helping us explore these essential topics, and thank you for your organization, Spectrum Leadership Solutions, for sponsoring this event. So as you've heard today, it is so critical to support each other's well-being, especially during this era of uncertainty. This aligns perfectly with the Fulbright Association's mission to foster international understanding and collaboration, and it's exactly why your support for the association is more important now than ever before. So I encourage you all to join our Stand for Fulbright 1946 campaign by donating to support the essential work of the Fulbright Association. Your generosity will fuel transformative programs and create vibrant spaces for innovative discussions that drive global education, research, and problem solving. We also invite you to advocate for the Fulbright program at your local, national, and global levels, helping our chapters to raise its profile and our national office to engage with our lawmakers. To make an impact, please scan the QR code on your screen or visit www.fulbright.org to contribute and learn more about how to get involved. Now, lastly, we're excited about our upcoming Fulbright Association Annual Conference, which is going to take place October 24th to the 26th. This year's conference promises an exceptional blend of inspiring keynote sessions, interactive workshops, and networking opportunities designed to foster innovative ideas and empower global education efforts. So we invite you to learn more about this event, also on our website, fulbright.org. Now, before we go, we kindly ask you to take a moment to complete our program survey. Your feedback on today's discussion and suggestions for future topics are incredibly valuable and help us to continue to improve and grow this series going forward. You will each receive an email with a link to our survey, so please participate and let us know your thoughts. So in closing, I wish you all the best, and I look forward to seeing you at future events. Thank you. Have a great time. Have a great day.